Hello, dear students. Welcome back to our news channel. Students, today we are diving into two big health stories from India, which impact many people, especially in the world of eye care and medicines. First, we will look at how India recently eliminated trachoma. Trachoma, basically, it's a harmful eye disease that can cause even blindness to some people. And why this is such a huge achievement for India. And then we will explore why the government recently raised the price limit on some important medicines by 50%. So let's get started. Students, imagine living in a place where there isn't enough clean water and sanitation is in poor condition. And students, a person who is living in these conditions, um, he can quickly catch a disease called trachoma because trachoma is caused by a bacteria called Chlamydia trachomatis, and this bacteria, it affects the inner part of the eyelid. आपका जो eyelid होता है उसका inner part होता है उसको affect करता है, right? And when this happens repeatedly, it leads to scarring and even blindness. इसकी वजह से कई बार ऐसा भी होता है कि लोग ब्लाइंड हो जाते हैं, ट्रैकोमा की वजह से ब्लाइंड भी हो जाते हैं. एंड ट्रैकोमा मोस्टली अफेक्ट्स द communities living in underprivileged areas, especially where access to clean water and healthcare is limited. All right. तो ऐसे कंडीशन में लोगों को ज्यादा होता है जो अंडर प्रिविलेज एरियाज में रह रहे हैं, जहां पे सैनिटेशन नहीं है, क्लीन वाटर नहीं है, हेल्थ केयर इज ऑल्सो लिमिटेड. नाउ when we talk about trachoma as a disease, it can spread through personal touch, like touching someone's hand, clothes, or even flies that have landed on infected discharge from someone's eyes. वहां से भी ट्रैकोमा इन्फेक्ट हो सकता है, स्प्रेड हो सकता है. And if trachoma isn't treated, it can make the eyelashes turn inward. जैसे आपके eyelashes होते हैं, वो inward turn हो जाती है, अंदर की तरफ turn हो जाती है, and it leads to scratching it basically scratches the cornea. हमारे आई के अंदर का जो पार्ट है कॉर्निया, उसको स्क्रैच करता है, and this causes severe pain and vision loss. ओके, कॉर्निया को वो अंदर की तरफ चला जाता है और कॉर्निया को स्क्रैच करता है, और जिससे विजन लॉस भी हो जाता है, राइट. एंड अगर हम वर्ल्ड लेवल पे बात करते हैं तो WHO ने ट्रैकोमा को क्लासिफाई किया है एज वन ऑफ द 20 नेग्लेक्टेड ट्रॉपिकल डिजीज. ट्रॉपिकल मतलब जो ट्रॉपिकल एरियाज में होती है, एंड WHO इज एमिंग टू एलिमिनेट दिस डिजीज from the world by the year 2030. And many developed nations, they have already eliminated trachoma. But countries like India, they were struggling for quite some time. And even some African and Asian countries, they are still struggling. So for many years, trachoma was a serious problem in India. And in fact, back in the 1950s and 60s, trachoma was a leading cause of blindness in some parts of the country. But that's all changed now, thanks to some amazing efforts from the government, doctors, and health workers. And just recently, the WHO announced that India has officially eliminated trachoma as a public health problem. It's a good news for all of us. Now, the thing is, how India fought trachoma. See, students, India's journey to eliminate trachoma didn't happen overnight. It began way back in 1963 with the launch of National Trachoma Control Program. And later, this program was merged into the larger National Program for Control of Blindness. And most importantly, students, the government and the healthcare focused on something called SAFE strategy. Yes, SAFE strategy, which in fact, World Health Organization also recommends. SAFE stands for surgery, antibiotics, facial cleanliness. Yes, and environmental improvements. Okay, environmental improvement जैसे access to clean water and sanitation. तो safe strategy की वजह से ट्रैकोमा काफी हद तक इंडिया से एलिमिनेट किया गया. एंड देयर वर आल्सो अ फ्यू थिंग्स, जैसे डॉक्टर्स ने सर्जरी परफॉर्म किया और एंटीबायोटिक्स. जैसे जब हम बात करते हैं सेफ स्ट्रैटेजी में, तो क्या होता है बेसिकली सर्जरी में क्या होगा? ऑब्वियसली डॉक्टर्स परफॉर्म सर्जरीज to treat the advanced cases. Antibiotics basically to treat infections. बहुत सारे लोगों को एंटीबायोटिक्स दिया गया ताकि ट्रैकोमा को पहले ही रोका जाए. Facial cleanliness. And see, health workers taught these the people who are living in underprivileged areas, they taught them the importance of washing their faces regularly, especially who are at the verge of catching this disease, right? And when we talk about the environmental improvements, the government worked on providing clean water and sanitation so that people could practice good hygiene and avoid the bacteria. And students, all these efforts, yes, ये जो सारे efforts हैं, ये रंग लेकर आए. All these efforts basically are paid off. And over the years, we have seen that the number of trachoma cases kept going down. In fact, by the year 2017, trachoma was no longer infecting people in India. But India didn't stop there. Okay, so क्योंकि हमें ये भी तो देखना था ना कि ऐसा तो नहीं कि अगर नहीं लोगों को हो रहा है तो पूरी तरह से एलिमिनेट हो गया है. ये भी तो देखना है कि कहीं दोबारा से इसके केसेस ना बढ़े. सो to make sure trachoma wouldn't come back, the government kept monitoring and checking for cases in many districts. Finally, in October 2024, this month only, WHO officially declared that trachoma had been eliminated as a public health problem in India. This means that cases are now so rare that it's no longer a threat to public health. Right. Now, let's switch gears and talk about generic drugs. Do you know what generic drugs are? Students, when a new drug is created, the company that invented it has a patent. Okay? जैसे हम कभी आपने देखा होगा कि वीडियोस मूवीज के नीचे लिखा रहता है कि कॉपीराइट है, और अगर कोई सेम चीज कॉपी करता है तो उस पे केस हो सकता है. तो वैसे ही जब कोई कंपनी न्यू ड्रग बनाती है तो वो पेटेंट उसका लेती है, मीनिंग ओनली दे कैन मेक एंड सेल इट फॉर अ सर्टेन नंबर ऑफ ईयर्स. But after this period, other companies can make their own versions of the same medicine called generic drugs. And these generic drugs work the same as the original drugs, but usually cost much less. And they are really, really very important because they allow people to get the medicines they need without spending too much money. Right? But here's where it gets interesting. Recently, the Indian government approved a 50% price hike on around 80 generic drugs. Okay? So, generic drugs पर government ने price hike किया है. And these includes medicines like infection, mental health, and other serious illnesses. So you might wonder, why would they raise the prices if these drugs are supposed to be affordable, right? See, the main reason is rising production costs. Okay, things like the ingredients needed to make drugs called APIs. जब हम बात करते हैं ना, जो मेडिसिन बनाने के लिए इंग्रेडिएंट्स चाहिए होती है, राइट? whenever you make whenever you try to bake a cake, you need ingredients जैसे refined flour, right? Eggs, milk. तो सिमिलरली जब ड्रग्स भी बनाते हैं कुछ इंग्रेडिएंट्स चाहिए होते हैं, एंड दीज इंग्रेडिएंट्स आर कॉल्ड APIs, active pharmaceutical ingredients. And recently we are seeing that they have become more expensive. The cost of packaging, transport, logistics, it all has gone up. So manufacturers need a way to cover these costs to keep making these important medicines. So by allowing a price hike, the government hopes that manufacturers will be able to continue producing these drugs without any issue. So how does this affect people in India? On one hand, some people will have to pay a bit more for their medications, but on the other hand, this change helps keep important medicines available. And the goal is to strike a balance between keeping medicines affordable and making sure that companies are also able to produce it sustainably. Now, this decision highlights the challenges the governments face when balancing, uh, the health needs and economic factors. And the 50% price hike may sound like a lot, right? But the government believes that it is quite necessary to ensure that people continue to have access to essential medicines, right? And students, here another key word is mentioned, NPPA, National Pharmaceutical Pricing Authority of India. Students, NPPA is a government body, and it is responsible for basically regulating drug prices, medicine prices, to make essential medicines affordable while also ensuring that the industry remains viable. And this organization was established in the year 1997 1997 में स्टैब्लिश हुआ था। और बेसिकली क्या रोल है, क्या इसका काम है कि कैसे ड्रग प्राइस को कंट्रोल करना है, राइट, कंट्रोल करना है, और जो मैन्युफैक्चरिंग इंडस्ट्रीज हैं वो भी सस्टेन कर पाए, राइट। सो एनपीपीए की प्राइमरी रोल क्या है? प्राइस रेगुलेशन ऑफ एसेंशियल मेडिसिन, प्रिवेंटिंग एक्सेसिव प्राइसिंग, पर साथ ही साथ ये भी उसका काम है कि कैसे जो प्रोडक्शन कॉस्ट है मेडिसिन की, वो उसको बैलेंस करना है, उसको अफोर्डेबल बनाना है, और कंज्यूमर को भी अवेयरनेस फैलानी है। एनपीपीए raises a public awareness about drug pricing rights, and it also runs a helpline for consumers to report non compliance। तो कोई अगर इश्यू आता है तो एनपीपीए का भी बहुत बड़ा रोल होता है। सो इट प्लेज अ की रोल इन मेकिंग हेल्थ केयर एक्सेसिबल एंड बैलेंसिंग द नीड्स फॉर कंज्यूमर्स। All right, students. So that's it for today. Bye bye. Have a happy learning.